This is Call the Psychiatrist. I'm Dr. David Handley.
And I'm Dr. Abby Snavely.
On this episode, Krystal's therapist would prefer she not use marijuana before a session, even though she thinks it would be helpful to loosen her emotional logjam. Michael questions his decision to be a therapist and whether he's actually helping anyone. We have feedback from Rachel from episode 40. And finally, Christopher is a therapist who wonders if we handle vacations around the winter holidays differently.
Say you like me, you better count the ways.
Listening to this podcast does not mean we have a doctor-patient relationship. Our intention is to educate and entertain you. Nothing we say is intended or recommended as a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your own physician or other qualified healthcare professional regarding any medical questions or conditions. Our first question comes from Krystal.
I'm feeling stuck in my therapy journey, and I need your help navigating a sticky situation. I'm struggling to fully express myself with my therapist, and while I'm a huge fan of his chill loft vibes, think floor-to-ceiling windows, beanbag chairs, and not a boring beige couch in sight, I hit a wall when I suggested using cannabis before our sessions. We have a great relationship, so I was surprised when he refused to even consider my idea. He said he doesn't work with clients under any substance influence. I'm crushed. I understand the professional boundaries, but here's my thing. I live in Colorado, where cannabis is legal, and honestly, I think a little pre-session puff could help loosen the emotional logjam. Therapy to me is about exploring every avenue. So where do I go from here? Is my therapist too rigid? Should I find someone with a more experimental outlook? Or am I missing some crucial communication technique that could help me open up and express my deepest, innermost thoughts? I've listened to your earlier shows and know you both support psychedelics for therapy. I guess I could be open to that too. But until they become officially legal, have you found alternative ways to overcome similar blocks? I'm open to all suggestions. I'm ready to break through this barrier and find a way to open myself up to what you call the process.
When I first read this, I was initially feeling a little self-conscious about my beige couch until I realized that there's no way I could get in and out of a beanbag chair all day.
This therapist must be very young and limber. Like that's what we know for sure.
Chill vibes.
Chill vibes
he
only.
Passes it, yeah.
Uh-huh.
So I think there's at least three topics here. There's the use of marijuana in therapy. Mm-hmm. There's the use of marijuana with Krystal's therapist specifically. And then I think the biggest topic, and maybe the most important, is that she's feeling limited in her ability to express herself in therapy. And that's what she actually wants help with.
Yeah. So let's take it one by one. So what do you think, Dave? We live in Colorado too.
Well, I think that as of right now, there's not a lot of evidence for the use of marijuana-assisted psychotherapy. Now, there's some, but it's all anecdotes. There was a study published a year ago with dissociative PTSD showing a benefit for one person. There are other studies, but they're usually poorly designed or they're underpowered. So we can't really make a lot of conclusions just yet.
No.
I think what I've been seeing people do, though, is try to adopt all of this literature that's being used in the psychedelics and just apply it to marijuana.
You know, even with the psychedelic assisted therapy, at least the protocols and the studies, I think, are not advocating for using a psychedelic before each session, right? I mean, usually it's a discrete experience, and then there is sober therapy, if you will, afterwards to integrate and understand what the experience was like. So I don't even think it's a one-to-one in the way that she's describing it or hinting at in the question.
Yeah, the people in Colorado who are doing this are basically following the protocol as if they were using a psychedelic, where you set an intention, there are the appointments ahead of time, the expectations are set, you have the experience, usually a little bit more prolonged than a normal session, and then you have that time to rehash what the experience was like. So you're right. I think what she's looking for, which we can get to in more detail, is she's wanting to become disinhibited enough to open up, or maybe to deal with some anxiety about it. But I think there's other ways to get at that.
I agree. Have you had patients bring this up to you or come to session high?
Yeah, I've had a couple, and it's interesting. Both of them. So the reason was they had forgotten that they had a session. Which I'm like,
just
maybe
happened to get high.
Yeah, well, maybe because you were high, you forgot the session.
I mean, right there. Well, and we'll talk about that too. But go ahead.
Yeah, they weren't as productive as I think maybe Krystal's imagining, as it turns out.
And I think while I agree that the intention is important and maybe the accidental nature of what your patients were doing came into play, but I also think, I don't know if anybody has hung out with people who are high. I mean, usually folks tend to think they're being way more interesting than they are, at least to the not high people. Sometimes things can be superficial, maybe especially emotions. I think there can be disinhibition, but I don't know that it's necessarily meaningful. And then, yeah, I also worry about what you hinted at, which is also memory issues. If somebody is high during the session, I would be concerned about their ability to integrate and remember and think on what we talked about in the session. And I know some of that might be dose dependent, but I don't think we can kind of isolate one facet of the marijuana use from all the other side effects, if you will.
Yeah, these people that are promoting it, which they're promoting it in a marketplace. I mean, they're trying to get people to do this.
Yeah.
They're saying,
and there's definitely a vibe of like, use marijuana for whatever ails you, right? Which is a little the same as the psychedelics.
They're saying if you only had the right selection, that it would actually become more psychedelic in its effect. And anyway, so I think it's mostly marketing.
I think the science on that is limited too.
Yeah. Go ahead. Now, I did have somebody who more routinely showed up high, and this was early in my career. So I had supervision with this patient for a long time, and then later on in my practice. But it was funny because when I talked to my supervisor about my concern, it all became about me. You know, why was I questioning my patient? What was it about? I know. It's like, it was a miss. But the concern was, wow, you've lost IQ points. Like nothing seems to be sticking from session to session.
Right. Or again, like you're strangely detached. Oh my God, I'm a miracle worker. Your anxiety is so much better. I mean, you're stupider, but the point was to decrease your anxiety. Maybe we're done. I guess, what are you supposed to do?
Yeah. Where I appreciate the compliment, but it really wasn't that profound.
Right. It's like, whoa. Yeah. So, I mean, generally, I think you're right. Like scientifically, we're not there yet, but I think even from, I don't know, just day-to-day experience, I think it's hard to really justify. I've had people say to me, well, this is my usual state. I'm high all the time. And so I should be high in here. And it's like, okay, but that's also kind of assuming that being high all the time is acceptable, right? You know, I think people smoke for all kinds of reasons or use, the disinhibition, but I think sometimes it is a coping mechanism. But I think in therapy, we're usually working on other kinds of coping mechanisms, maybe healthier coping mechanisms at the risk of sounding judgmental than just relying on a substance for that. So again, if it helps you get away from your anxiety, okay, I get that. So does drinking at a party. These things are classics for a reason. But if we're trying to understand your anxiety, work on it, look at your defenses, I also, I guess, think that a patient is probably not showing me their other defenses if the primary one that they're relying on is being intoxicated.
Yeah, right. Well, if Krystal wanted somebody, I don't think she should break up with her therapist over this by any means.
No.
But I did find there's plenty of people in Colorado, and I pulled this quote from a website.
All right.
By using cannabis during therapy, you can move past the basic and conscious benefits of talk therapy and access something different, the innate healing potential of your autonomic nervous system. It's very sciencey.
What? Science-ish. I know all those words.
Yeah. Well, they're adopting it from the psychedelic literature, so I don't know.
I understand. And I guess people have, spiritual experiences on marijuana. But again, if people are talking about using it every time, then I don't know what we're getting at. And I don't think there's shortcuts. I guess that's some sort of cultural commentary. I understand the desire for a shortcut or a way to get there easier or better, but I don't think that's how it works.
Yeah, I think that's a good segue then into what it is that she's wanting, which is this emotional logjam that she has, and this is completely tangential, but marijuana was studied during World War II as a truth serum. That's what this actually reminded me of, is she's wanting the disinhibition that might come from the truth serum. So those would be sodium amytal or sodium pentothal. But the CIA tested most psychoactive drugs to try to find something that would disinhibit somebody. Alcohol, in vino veritas. But they issued...
But really quick, but that's also supporting this idea that what we're trying to do is get to some narrative or factual truth, which can be helpful, but you're totally skipping the process. And I think the process is the thing that actually makes people better.
I agree with you. But
even if it made you more honest, which it doesn't.
No, but that's what I wanted to share was like the funny part, or what I thought was more humorous, was that according to the CIA, yes, it got people talking a lot more, but they were just as likely to lie. So
good. Well, but I'm just saying, who cares, right? I mean, yes, we did do an Amytal interview with somebody when I was a resident. But it was a guy who...
He had a dissociative fugue. No, I was a chief, so I was really aware of that case. But a dissociative fugue.
It didn't work either. The only thing that worked was putting him on TV and his wife saw him.
I think that's the only time in my career, though, I've even known somebody trying it. And I know, you're grasping at straws. He'd been in the hospital for weeks and weeks, and nobody knew who he was.
And the attending was like a real... wonderful, but old man.
Yeah, he was old enough to do it.
He was old enough to do it. He was old enough. It wasn't his first rodeo. We're all like, what? This still happens? And he's like, it does now.
Yeah. Also, the Aurora theater shooter, the judge had ordered that it was okay for him to have a narco analysis, is what they used to be called, given a drug for an interview. I don't know if they actually did it or not, but I do remember that part of the case, which I thought was kind of interesting.
Well, and in those cases, yes, finding out some factual information would be super duper helpful, right? Mm-hmm. But I don't think it doesn't sound like Krystal is in therapy right now because she's trying to uncover some hidden memories.
No, and this would be a terrible way because of the suggestibility too. Like that's actually 100%. One of the biggest downsides to substance-induced memory recovery is it's too easy to plant false memories.
And fabricate, right?
And fabricate, yeah. Anyway, it's a complete tangent. It has nothing to do.
I love it.
This is what I associated this with, was just the idea that if I could loosen up this, as she says, this logjam, if I could get past this barrier, then things would go faster. And I think that's what you're saying, is like looking for that shortcut.
Right.
The final question is then, well, so what can she do? What are some things that we can advise?
I mean, I assume they are trying to figure out what the logs are in said jam, right? That they are trying to understand what is getting in the way for her. We're kind of reading between the lines and wondering if it is anxiety or something else. I wonder about her marijuana use outside of the session in terms of just, again, how much she's able to use or integrate, or how often is she exposed to uncomfortable emotions or forced to be outside of the therapy. I don't know how long she's been seeing this therapist. I don't know how often she goes. I don't always think that more therapy is the answer to whatever the problem is. But here, when she's talking about having a great relationship and liking this man, but feeling like she can't get through something, it might be time to turn up the heat, which, again, I think would be frequency or more time, which is kind of the opposite, where she's thinking, well, maybe if I turn it down, I could get through. Mm-hmm. It's going to be more uncomfortable, but I think it's going to be more rewarding and more processy, as she said at the end of the question.
Yeah. For a lot of people, they're not aware that they're shut down over certain things. And so then it's the therapist's job. I mean, I feel like that's where the onus is on us to really notice those times, when they're being avoidant or the defenses are particularly strong, and you want to get them positioned so they can recognize that there's something there. But I think with Krystal, she's perfectly aware. So now the question becomes, are you aware of the particular topics that you can't talk about? Is there something historical that's too dangerous? And if that's too much to go diving into, then you take a step back. I mean, it's a little bit more meta, I guess, in some ways. You talk about what your fears are if you were to let those emotions out. Like, is it a fantasy that you'll break down? You're never going to be able to reincorporate yourself, whatever it is. But I think that if you're ready, shining the light in that direction will ultimately help you get moving.
Right.
And because that's the other point, is maybe she's not ready to get into some of this stuff. I don't know. I mean, again, I think the fantasy she has that she's looking for this catharsis, which is very much like a movie trope. The dam is going to be broken, the floodwaters will pour out, and now the healing can begin. But that's really not usually how this happens. Most people can't tolerate that kind of catharsis. It's very destabilizing.
There is benefit really in understanding what is getting in the way and what has been hard. Like, she may learn just as much about herself in the process of getting unjammed as she does kind of on the other side of it. And so it's not just like, oh, you have to go through this sucky part before, like you said, the healing can begin or something good can happen. It's like, no, this part is good. And sometimes the hard thing is good. I don't want her to be stuck or unnecessarily frustrated. And I think you're right. By the end of what she wrote out, she gets to her actual question, which is how to open up. But higher up in what she's talking about, she felt crushed, I think was the word, that he didn't even consider her suggestion. And maybe he needed to explain it better or talk to her about it more. But my hunch is it's because he wants to help her and he just doesn't think that this is helpful.
Yeah. Right.
He gets to decide.
Yeah, I think having that boundary, I don't think there's any problem with having that boundary.
No, right. And if you're not willing to consider it, don't consider it.
Yeah.
Talk about it, of course, but that's it.
He may have other boundaries that you don't like either. I mean, that would be
and I guess that's the other part is like sometimes also when the patient doesn't get what they're wishing for, that also can be very painful, but also very important. Like it is not our job as therapists to gratify every wish that our patients have, which is not, this isn't talking about Krystal, but just like in general.
Yeah.
It's like, it's not always bad if they don't give you what you want.
I see this as being, I mean, I don't know when she wrote the question, obviously, but it's okay. You've identified a problem. You've been able to bring it up to him. He's acknowledged it. So now that solution was taken off the table, but I'm guessing he has other ideas now. I mean, now that it's out there.
And he needs to know how you felt about
being rebuffed,
the denial of that wish.
Yeah. And then, I mean, if you really want to explore this, I don't think it's showing up, as we've already said, high for a couple of sessions. And I don't think it would mean terminating with him, but if you want to go and explore this with a different counselor or somebody, you can do that. But I don't know. I think that might be misuse of your time and money, but I don't think there's anything wrong with it. You should talk to him about that first, though.
I think that's fair.
Well, best of luck and let us know what happens.
Yeah.
This question comes from Michael. I've been in practice for nearly 2 years. I'm beginning to lose faith and hope in being a therapist. There are so few direct gains on a day-to-day basis, and because of confidentiality, no one to share the details of my cases with. I'm constantly doubting if I'm even helping my patients at all. I've listened to your show, and you found a way to make this profession work. How do you know if you're meant to be a therapist? What is it that tells you that you offer good enough therapy to treat your patients? How do you evaluate your professional success? We don't have a lot of information here, but I have to wonder if Michael is experiencing burnout. I would like for him to reflect on that for a little bit before he makes any major career decisions.
How would you tell? Because I feel like burnout is a hot topic word, right?
Yeah, I mean the thing that he mentions that had me thinking this way is that sense of being ineffective. So I guess I would want him to reflect on this. Are you being exhausted by work? Are you becoming really detached, apathetic, irritable? Are you fantasizing constantly about how to escape and get out of this job? Are you getting sick all the time? Are you not sleeping? I mean, I think all of those, if we had more information, we might say this has something to do with it. Although honestly, I don't know that my advice is going to be that different, whether he said, hey, I'm burned out, what should I do versus am I being ineffective? But I also
would want to know if he ever enjoyed it, right?
Well, and I think that's part of the exploration here is like, what got you into this in the first place? What excited you? What was intellectually stimulating? What was emotionally beneficial? And again, so I don't know if our advice is going to be different. If this is more about burnout, I think that might increase the intensity at which he needs to address this, as far as maybe getting some outside support.
I think so. And I guess I actually also think in general with burnout, often it is people's inclination to kind of work harder to fix the problem of working too hard, right? And so maybe it's a little bit different in terms of diving in more or getting more into it, getting more supervision, reading more, getting more training, like could be something if it's not about burnout. But if it is about burnout, it might be about taking a break or workload or figuring out more work-life balance or something else. So I think that might be the only main difference, at least in the short term or like big umbrella categories of what to do about it. But yeah, I guess that would be my main question to kind of differentiate is, like you said, all those things. How did it used to be? How did you fantasize it was going to be? And then when did it take a turn?
Yeah. I think the biggest first thing that I would want you to think about is how do you increase your sense of agency? Like, is there, and I know that control is always an illusion, but are there things you still have some control over? So I would wonder, For example, does he have any control over how frequently he sees his clients? Does he have a say in the type of clients he sees? Does he control his own schedule? Can he choose to have a late start one day, stay late another day? Does he have boundaries at work? Do things just continue to pile on relentlessly and he's completely smothered by it? Is it one of those clinics where it's just churn, churn, churn? Is he maintaining a social life, or has work completely replaced his social life? So I think that bigger picture is like, where do I still have some say in my life, and where can I maybe start setting up some of these boundaries
and control some of it?
And the other thing is getting support. Even in a supervision group, he said that he can't talk about it, so he's feeling very isolated. And I don't really see that. You can talk about your clients. You just need to obscure their identifying information, but you don't need a lot of details to get support.
Not at all.
Because most of the time I think what we are sharing, like if I'm talking to you, Abby, like I might be sharing my reaction to something, but you don't need to know the details to understand my experience of the reaction.
No, not at all. Or even to know like who it is, to know the parts of their story that maybe got to you or affected you. Again, the focus, I think, in peer supervision or talking, with your friends and colleagues, I think can also be, yes, you can ask for advice to be helping the patient, but it's also for him, which is another factor I wonder about here, is if he is getting burned out, either officially or not, on kind of constantly putting the focus on other people.
That tends to be the case, caregiver kind of burnout.
Yeah, right. I guess maybe that's kind of an extension of agency, but is there a place where he's important or where he gets to be the one that's being taken care of, or at least something's like a little bit more equitable?
Yeah, and I think if group supervision with colleagues doesn't sound like enough, like if you're struggling with case formulation, like what's going on and what to do about it, now that you probably can't share as much. That's where I think you need more formalized supervision. I feel like some people may have this idea that if they go to supervision that's a failure, like they weren't trained well enough, like he's only 2 years out. So that's some regression. But no, I think that could be something that could also revitalize your interest in the things that you used to like, and challenge you to do something different. Like if you think you're not being effective, then getting somebody else to see what it is that you're doing is really valuable.
Yeah, now, and kind of exciting sometimes, I think, to be able to think about it in a different way.
And then finally, so there's the group supervision, there's individual, but if what you're really struggling with is your emotional response, and I think that's what you were kind of referring to, Abby, then I think it's time to get back into therapy, assuming that you did some therapy as part of your training, or if you didn't, then this might be a good time to do that too. Because again, I don't think that's where you don't need to take that to group supervision.
Not at all. So therapy, right? Self-care, exercise, having a life outside of it, all of that stuff. But this is all assuming that, and this is not an absolute, obviously it's not a black and white answer to the question, but does he want to be a therapist? He's talking about, are you meant to be a therapist, which is a heavier concept. But these are all ways to make sure before he throws away his training. It's not that it's a throwing away, but moves on in a really radically different direction after training and spending all this time on it. Right?
Yeah.
I think we'd want him to make sure. So everything we're talking about now is sort of like, try to do all this, try to get back into it, try to figure out how to kind of address these concerns before you bail.
Yeah, I agree 100% because it's incredibly scary to think that you've made some mistake and you've invested all this time, money, energy. And it's okay. You don't have to be a therapist if it's not the right fit for you. It's
right.
100%
Yeah.
okay.
No. Like,
but you do need to.
You don't want to feel trapped. You're not.
Yeah, you're not trapped, but you do, I think, need to spend a little time exploring this before you can actually make that decision. I just don't know that you can make it right now. Or maybe you can. Maybe you've been thinking about this you've been unhappy ever since you got out of your training program. So I don't know.
Yeah. I think that's right. We are talking about training. I think there sometimes can be a tendency for folks to think that like another training is going to be the thing that gets them there, right? Like, only if I learn a different set of techniques, I'll be able to help these people more. It's going to feel better. Sometimes that's the case. I think analytic training was helpful for me in a number of ways, including giving me an opportunity or a framework to think about people in a deeper way or understand them in a way that was a little more broad or complicated. And I think it has protected me some from maybe getting as bored or as burned out. And I'm not saying that's the only way to do it, But I also think just generally, therapy tends to be something that people can get better at with time and with age. Like 2 years really isn't that long to get good at this. I mean, I think he needs more wins. I think that he needs some gains, some other things. But I guess I also just want to put a plug in for if you remain conscientious and you remain engaged, I think it's guaranteed that overall your skill and your confidence will increase with time.
I think that's true. I think one thing that helped me, I've been very, very lucky in my whole career. I've never had to just do one thing all the time. I've always had various populations and various locations, and it keeps you a little more grounded, I think, keeps things in perspective. And then he was asking, how do you know people are getting better? And I guess I just want to let him know too that
I don't always.
Yeah, not everybody's going to get better. A lot of people will.
Yeah.
It depends on how you're working, what your patient population is. And this will sound a little more like a medical model, but sometimes we're managing chronic conditions. And so you don't measure the success by the elimination of the problem, but by maximizing their functioning or their ability to cope with the problem.
And it may be, I know we talk about the relationship a lot. It can be things like that. I think sometimes in residency, supervisors would often say, well, if they keep coming back, they're obviously getting something out of it. And I don't think that's enough.
No.
But I do think there is something if people are taking their time, their energy, their money to come spend time with you, often they must think it's worthwhile for some reason. And I'm not saying that has to be enough for him, but I also wonder if empathizing or mentalizing or putting himself in his patient's shoes to be able to say or even ask them. I mean, I've had people where I feel like it's really stuck and I'll just say, let's kind of see where we're at. Does this feel helpful to you? Right? I just want to be helpful. I want to help you. And I want to see what you're getting out of it. And, maybe there's a way to make it better. Maybe not. But I think sometimes people are getting things that, like you said, maybe aren't the chief complaint or like the target symptom, but there might be things that sort of are getting better on the side that they don't talk about. Because also people don't always talk about things that are getting better. Some people think they can only talk about negative things when they come to therapy.
Right. Yeah, I suspect he's more important to people than he realizes, and
that's it. Yeah,
and it's okay.
And they may or may not be able to say it, but it's worth trying to explore.
Yeah, it's also okay to make sure you're both working. That you've at least articulated the goals that you're working towards.
Sure.
Sometimes, especially with longer term therapy, it can get pretty muddled.
Yeah, absolutely. For Michael specifically, I don't know which way it is, but I kind of wonder if either the therapies are getting dragged out and directionless, or if for some reason things are, getting cut off before he feels like he can make a difference.
Yeah.
Maybe it's both, right? Like, is it too long or too short or too frequent or not frequent enough, or people are too stable or they're too sick? Like some kind of balance, which is going to be different for everybody, but also, like you said, paying attention to having a variety, but also knowing like who he likes to work with.
Knowing that the context where he's working would be helpful. It's like I suspect that if he's in private practice, he's too isolated. And if he's in a group practice, he's maybe just overworked or doesn't have enough control over it.
Yeah, we could make a lot of generalizations, but there's something that's out of balance here.
Yeah.
But maybe it's that of saying like, where can we tweak the balance instead of a more binary, you be a therapist or you don't? Because there's a lot of different ways to do this.
And if you hate it, I give you permission to leave it.
Absolutely. And because you know what? All those therapy skills you got are going to be helpful, like basically in any job. I mean, it's harder when people don't want to hear your opinion as much when you're out in the world, in my experience.
When they're paying to hear it.
However, your people skills, your psychological understanding, all that stuff is knowledge that can benefit you forever.
All right. Well, let us know what you decide or kind of how this unfolds. I'd be curious to get more information.
Yeah. Hang in there.
This is an update from someone that we called Rachel back in episode 40. This was our listener whose therapist she thought was hiding from her at the grocery store. I asked the therapist if she was hiding from me, the magazine incident. She told me it wasn't her. Fast forward a few weeks, I finally terminated with her. She told me at our last session that I have all the tools but aren't using them. Basically, I'm not trying hard enough. Then, as I'm sitting there crying and upset, she tells me if I don't want to come in next week, I can take the week off. Note, this is right before Christmas holiday. She didn't comfort me. The last few sessions were horrible before this. I now know what people mean when they say they were hurt during therapy. I told her in an email, explaining why I was terminating and that she has no compassion or empathy. Her reply was she'll take what I said into consideration and that I might want to look into family system therapy. No referrals, nothing. I was in transcranial magnetic stimulation at the time, broke down crying in the session after I left her, and they stepped in with their nurse practitioner who called in a favor with a trauma therapist who was not accepting clients but met with me. I'm now seeing her. The kicker is she had heard of the same treatment from this therapist happening to others in our small town. I should have left the first time we weren't connecting, but I didn't want to start over. She really damaged my trust in the system, and I feel like an idiot for letting it go on for so long. I love the podcast. Oh, Rachel, I'm sorry you feel like an idiot. I don't think you're an idiot.
No.
I think most people try to stick it out with somebody, especially if that person's in a position of authority or someone that was in a position to try to help you. Mm-hmm. We tend to think it's our problem, not theirs, if things aren't going smoothly. I generally don't recommend leaving a therapist too early in treatment unless there's been a major boundary violation or you're just like really creeped out by them. Because sometimes understanding why you're not clicking can actually lead to some insight for you.
Yeah, because she says, I get the sentiment. She says, I should have left the first time we weren't connecting. I'm like, not the first. Probably not the first. Because you couldn't have known, right?
Yeah.
I mean, this is such concrete evidence that getting out of there was the right idea. I understand her wishing to have avoided all that pain. But I also don't think she should be blaming herself for not knowing that back at the first time they didn't connect, that she needed to get out of there. I think that's impossible to know.
Yeah, when speaking of blame, then the therapist is also blaming her for not getting better. I gave you the tools, you weren't trying hard enough. Or you didn't want it.
And if you're crying, maybe you should take a week off. Like that's the most wild part to me.
Episode 25, we had somebody in a similar situation where they were blamed for not getting better fast enough. And it would be fine just to, if the therapist said, this isn't a good fit or.
Sure. There's so many ways to do this, right? Yeah. And, I mean, I guess it is, again, validating or in line. I know that's not what Rachel was probably looking for, but she says, you lack compassion and empathy, and like a compassionless, empathyless robot, the therapist says, I will take that into consideration.
Talk about burnout.
Right? It's like, okay, all right. I mean, I thank you for that confirmation. They, pointing that out did not cause her to come around and try to correct anything. And so, okay. So whatever it is going on with this therapist, I don't think it really has much to do with Rachel at all.
No, and we didn't know in the first time she wrote in that she was getting TMS.
Right.
And we only know what's in Rachel's messages. But
sure.
I think if you're getting TMS, things aren't going great.
I would say, yeah, that's a pretty intensive treatment, right?
Yeah.
People don't just do it for fun.
So if she were severely depressed, it can be hard to use some of those tools.
Of course.
It could be hard to keep a thought record or a journal, if her brain's not doing that great. So I don't know. This was just very
again, I don't know, man. I believe that, the relationship is an important part of this. It's not about tools. If it was about tools, Rachel would read a self-help book and do what it said and not need a therapist.
Right.
It's dumb. That therapist is undervaluing herself too. Well, it might be the right amount of value, but undervaluing therapy.
Well, I'm sorry you're going through this. I'm glad you're able to move on. And it was her at the grocery store.
100%.
No doubt.
No doubt.
Dancing just you and me.
This question comes from Christopher.
As a counselor entering my third year, I frequently turn to your podcast for guidance, particularly on the topic of vacations. From my experience, and presumably for my patients as well, there's a distinct contrast between taking time off in the summer and during holiday seasons. Each impacts my clients differently. I've established a confident routine for summer and spring breaks. I inform my caseload well in advance, discuss my absence, and ensure that they have access to alternative support if needed. However, the period leading up to Christmas and New Year's presents unique challenges. The intensity of sessions escalates, often revolving around deep-seated family issues or the mourning of lost loved ones. Given these differences, do you adapt your client preparation strategies for winter breaks as opposed to summer ones? How does your personal approach vary? For me, the winter break is vital for mental rejuvenation and gearing up for a fresh start in the new year.
I think this is one of the biggest overlaps between our profession and hairstylist because everyone wants in before the holidays.
Okay. Except unlike hairstylists, I think what we do in preparation is only, I'm not going to say minimally helpful, but is less likely to meet the client's needs. Right? Like my hair is going to look great at Christmas. Like that I can make
But you're
sure
still going to
happens.
fight with somebody. Yeah.
Yeah, absolutely. Right? Because it also involves other people. But anyway, continue.
Well, no, I think you experienced a lot of this year. I think before Christmas, it seemed like everybody you've ever known wanted to be in your office because you were taking time off. So I mean, I think you can really relate to this.
Oh, I absolutely can. I mean, I take time off around Christmas for a few years. It's been about 2 weeks, which is lengthy, but it also coincides more with my kids' schedule. And just like Christopher says, I also think it's really helpful to get rejuvenated or get ready for the new year. But I think, as folks are going into holiday season, you're right, it involves more family. It can involve travel. It can involve pressure. It can involve financial stress. It sometimes involves a lot of drinking. There's all sorts of stressors coming. And I do think it's helpful to try to prepare people as well as they can and remind them of their strengths and their coping skills and boundaries and all these things. But there's only so much pre-work you can do. And then even during the break, when people are in the midst of it, I actually don't think that that's usually the best time to be processing it. Like we can post-hash, right? There's coming back in January. To me, January is the most intense month because not only have we taken a break, but also all of the activity and sometimes drama of the holiday season has worn down and folks are left to sit with the aftermath. And I think that is where we can be more helpful.
Yeah, I think you just road tested a lot of stuff over the holidays. You had the whole year of trying to make some gains, and it's like, here's a great test for you to see if any of this is going to work. So they come back in, and then you get to, as you said, sort of the post-hashing it or whatever. See where they're still struggling, see where they're making some gains. So I agree. Yeah, January I find to be a little bit more of the struggle. But I think, Christopher's right. It is completely different. It's not the same as a normal vacation. People might think they're going to struggle with you're gone in, the summer for a week, but they're almost certain that they're going to struggle during the holidays. And they're right. I mean, it's not like they're making it up. They're going to see people they don't like. There's going to be conflict. They may be
or
sad
they're going to be
because
alone.
They're by themselves. Yep. They're mourning someone that may have died. So they're completely right, but I agree with you that it's usually after the fact that you can make more gains in therapy, at least.
And I also think, in our culture, almost everyone has at least some time off during the holidays, which I think can make it different, right? So not only are the patients not meeting with us, but they may not be having a regular work schedule or things like that. But I also think culturally, there's all these expectations about what an ideal Christmas or holiday is like. And so I also think that the fantasies that the patients have or ideas about what's happening for me are much more in the camp of me, the patient. My Christmas is going to suck, but my therapist probably is part of a Norman Rockwell painting or whatever, right? Like whether or not that's true, but I think it's easy to focus on kind of what we don't have or the ways that we aren't living up to an ideal holiday season. And I think the therapist is a natural place to set up that dichotomy.
Yeah. Yeah.
And that can be hard too. And I'm just like, listen, man, I'm getting prepared for my own family. I mean, we are all kind of in this together, and we're going to regroup in a couple weeks.
And I think to underscore that point, that often the patients may have some time off work. They may be traveling. So one thing that's very different, I guess, about any other time away from the office is that we can expect that this one's going to happen. Like you can know in January that it's likely that I'll have some time off around Christmas. I can expect that you might have some time off in December or January as well. So if we all know about it, then you can start preparing as soon as you want. Like I have people where we have to start talking about the winter holidays in September, by the end of September.
I mean, I'm already talking about next year with some people now. We will probably take a break from talking about it until the fall, right?
Yeah.
But since it's fresh, I think that's also part of it.
Yeah. And you alluded to this earlier, but it's like with anticipatory grief, knowing something is about to happen doesn't make it that much easier when it does in fact happen. So,
No, it
there
really
is a point of diminishing returns, I think, in trying to gird everybody to survive the break in the winter holiday time.
And I hear Christopher saying all the right words about why he needs this and maybe deserves it. I wonder if he is struggling with a little guilt still. And I think that's totally normal and common. But I think the more he believes that, the easier it makes it, right? I think accepting that this is what's so and this is what's going to happen and you're going to work really hard. I mean, I definitely hustled on both sides of this holiday break, but not falling over yourself by feeling guilty or feeling excessively responsible for what the patients have to deal with in between is probably helpful too. So that's the work for himself.
Yeah, I don't think he minds the hustle. I think he's, as you're saying, I think he feels a little guilty.
I think he does. But that'll get better with time too. Probably.
It will.
Yeah.
It will.
God willing.
But because he's right. He needs the break too.
Yeah, he does.
And your patients will thank you for it, that you took a little break.
Yeah. And to model it, right? I know we talk about that a lot, but I've even had people say that. I used to get mad at you, but it also helped me take vacations too. I'm like, great. I'm a vacation evangelist. This is for everybody.
All right. Well, thank you all for listening. And a special thanks to Krystal, Michael, and Christopher for your questions, and to Rachel for the follow-up.
As always, love a follow-up.
Love them.
That was good. I mean, I don't love how that went for her, but you know what I mean.
Like to hear what happened.
Yeah.
And she was hiding behind the magazine. We love getting your reviews, your feedbacks, and your questions. You can send an email or leave an audio message at our website, callthepsychiatrist.com. You can email us directly at callthepsychiatrist@gmail.com. You can join us on Instagram or Facebook at Call the Psychiatrist. But the most important thing we ask is for you to please tell a friend about the show so we can find new listeners. Take care.
Bye.